All right. Well, let's go ahead and get started. We may have some latecomers, but that's all right. We got a lot of information to cover and I don't want to keep you guys too long. Hopefully everybody can hear me all right. If you do have any issues with the volume or being able to hear me, please unmute and let me know, or you can type it into the chat box and we'll try and get that addressed. Thank you for joining us tonight for our first Medicare 101 4-part series of 2022. Tonight, we're going to be talking about Medicare eligibility and coverage. Hopefully, everybody received the email that I sent out earlier today that included all of the handouts that accompany this presentation. If you did not get that email, please feel free to type that into the chat box or let me know when I pause at the end for any last minute questions, and I'll be sure to be able to get those to you again, either by email or some other way. I will pause at different parts of this presentation in order to take questions. If you have a question, please feel free to type that into the chat box at any time, and I will address them at the pauses. Or when I do pause, you'll be able to unmute yourself and simply ask your question live. Otherwise, I think that's all the housekeeping I had for us. So let's get started. Not seeing any issues with volume, so hopefully again, everybody can hear me. So again, this is part 1 of our Medicare 101 series. This is a 4-week, 4-part series that goes in details about everything you never wanted to know about Medicare. And tonight we are going to cover eligibility and what Medicare A and B actually pay for and how much it costs. My name is Roma. I am with the Area Agency on Aging, the Pikes Peak Area Agency on Aging, through the Pikes Peak Area Council of Governments. And I am the SHIP coordinator for our region, which is El Paso Park and Teller County, but it also Chaffee Lake, Los Animas, Huerfano, Custer, and Fremont counties are part of our service area. So let's get started with who we are. Again, I work for the Area Agency on Aging of the Pikes Peak region. We are located here in Colorado Springs, and the mission of the Area Agency on Aging is to work with the community to provide assistance and coordination and development of programs and systems that help people stay in the community and in their homes in the primary service area of the Area Agency on Aging, which is El Paso Park and Teller counties. So that people can stay in their homes for as long as possible. Again, I am with the SHIP program through the Area Agency on Aging. The SHIP program is a federally funded program that's solely and specifically designed to provide free, unbiased, one-on-one insurance counseling and education to anybody interested in getting Medicare information, including beneficiaries, their family, friends, and caregivers. We can help people understand any and all aspects of Medicare and anything related to Medicare. So we will be talking about original Medicare A and B. We'll talk about the differences between Medicare Advantage plans and Medicare supplements or Medigaps. We're going to talk about Medicare Part D, the new prescription drug benefit. We're going to be talking about how Medicare coordinates with retirement plans and all those kinds of things throughout this 4-week period. We can also help people who have limited or lower incomes with applying for financial assistance programs to help cover some of the costs of Medicare. Again, our office, the SHIP program through our office here in Colorado Springs actually does counseling for a total of 9 counties in Colorado. This slide shows you our local Colorado Springs number, as well as the statewide toll-free number. And if you call the statewide toll-free number, it'll route you to the SHIP office closest to where you're calling from. There should be a SHIP office or a SHIP counselor available to every person in every county of every state throughout the country. And again, that's to provide free, unbiased information and assistance on all things Medicare. So We're going to start with what is Medicare. And we're going to talk about all these different parts, but today we're going to focus on Part A and Part B. But we're going to start even further than that by talking about who runs Medicare. In order to enroll in Medicare, you have to contact Social Security. So it is the Social Security Administration who determines who's eligible for Medicare. They process Medicare enrollments. They provide the original Medicare cards. They are available by toll-free number. You can call their nationwide toll-free number from 7 a.m. to 7 p.m. in all time zones. Or you can go to the Social Security website, ssa.gov. You can create a personalized account on the Social Security website, and you can enroll in Medicare that way. And it also can provide you with a lot of good personal information about your work history and whether or not you're entitled to Medicare benefits. Or you, hopefully one of these days when pandemic ends, would be able to go to local regional offices of the Social Security Department if you had issues you wanted to talk about in person. So it's Social Security who determines your eligibility. They are where you go to enroll in Medicare. Once you've enrolled in Medicare, Social Security wants nothing to do with you. And any questions you may have regarding your Medicare benefits would be directed to the Centers for Medicare and Medicaid Services, which I will refer to simply as Medicare. So once you're enrolled in Medicare, any questions you have about benefits, claims, any of that kind of stuff would be directed to Medicare directly. So the Centers for Medicare and Medicaid Services processes claims, they administer the program, they determine benefits, they pay the providers directly. Medicare can be reached by their toll-free number 24 hours a day, 7 days a week, 365 days a year. There is no brick and mortar location for Medicare. You can only contact them by phone or you can get information online. There is no local offices for Medicare. So who can have Medicare? Well, anybody who is a US citizen and becomes age 65 or older will become eligible for Medicare. Typically, you become eligible automatically at age 65 by paying into the Social Security tax system. So by having employment that is taxed, those taxes go towards Social Security and towards Medicare directly. That's why Social Security is in charge of who's eligible for Medicare, because they are the ones who keep track of what taxes you pay to determine how much you pay or how long you pay into that system to make sure that you become eligible for Medicare. You can also become eligible for Medicare at any age if you are determined to be disabled by Social Security. You can become eligible for Medicare at any age if you are diagnosed with end-stage renal disease and receiving kidney dialysis, or if you're diagnosed with ALS or Lou Gehrig's disease. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years can also become eligible to purchase Medicare. When should you enroll in Medicare? Well, these days, most people who become eligible for Medicare at age 65 may not necessarily be ready to retire, and that is becoming more and more common as time goes on. So you don't have to be retired to enroll in Medicare, but you do need to be aware of some enrollment periods, especially the enrollment period surrounding your 65th birthday, which is most people's initial eligibility, and determine whether or not you need to enroll in Medicare when you turn 65. So when you are approaching age 65, you are entering what's called your initial enrollment period. That initial enrollment period is a total of a 7-month window. That 7-month window starts up to 3 months prior to the month you turn 65, the month you turn 65, and the 3 months after the month you turn 65. During that 7-month window of your 65th birthday is when you can enroll in Medicare without penalty. There are other enrollment periods that you may be able to take advantage of, and we will talk about all of them in the next few slides. If you don't take advantage of any of your enrollment periods that you may be eligible for, there is an annual enrollment period that you could use, that anybody could use. But anytime you don't enroll during initial or first eligibility, you could potentially be looking at penalties for not enrolling in Medicare when you first initially became eligible. And again, we're going to talk about all of that in more detail. So the three primary enrollment periods that most people need to be aware of are, of course, the initial enrollment period surrounding turning 65, that 7-month window around your 65th birthday. But a lot of people will also qualify for what's called a special enrollment period. A special enrollment period is used for people who decide to delay enrollment into their Medicare benefits because they are still actively employed and are covered by employer group health coverage based on that employment. So if you are still working and you have health coverage through that employer and you're approaching age 65 in Medicare eligibility, you could actually choose not to enroll in Medicare in favor of that employer coverage through your work. And when you stop working and lose that employer coverage, you would have a special enrollment period in order to enroll in Medicare without penalty. That special enrollment period for when you stop working and lose your employer coverage actually lasts for 8 months from the time your employment ends. Honestly, that is really the only excuse Social Security will accept for not enrolling in Medicare when you first become eligible at age 65. So if you're turning age 65 and you're not actively employed or covered under a spouse's active employment group health coverage, you're strongly encouraged to enroll in Medicare. If for some reason you don't enroll during your initial enrollment window, you weren't covered by employer coverage, either through your own employment or a spouse's, you would still be allowed to enroll in Medicare any given year down the road during the annual general election period for Medicare. The general election period runs January 1st through March 31st each year, and coverage wouldn't begin until July 1st of that year. So there's an extended delay period if you are enrolling during a general enrollment period. Also, if you enroll during a general enrollment period, you may have to pay a penalty, meaning you'll have to pay a higher monthly premium for your Medicare because you did not enroll when you were first eligible. And again, we'll talk about that as in the slides coming up. Now, starting in 2023, I believe, that delayed coverage start date during a general election enrollment is going to change. So for years and years and years, if someone enrolled during the January 1st through March 31st period, their coverage never started before July 1st of that year. That law is going to change and next year. And as soon as you enroll during the January through March period, your coverage will start the first of the next month, which is going to be a huge change and a huge benefit for most people who enroll during that period. This slide shows you what the new Medicare cards look like. I say new, but they've been around for a few years now. I usually refer to it as the red, white, and blue card. It will include your name. It will include your Medicare ID number, which is simply random series of letters and numbers, 11 digits as your ID. And it will indicate when your Medicare Part A and Part B go into effect. And that's all it will ever indicate. It will never indicate if you were enrolled in a drug plan or any other kind of coverage with Medicare. It will only show your A and B benefits starting date. So if you are becoming eligible for Medicare, a couple of things to keep in mind. Make sure that your current contact information, meaning your mailing address, is up to date at Social Security. Because that is what Social Security, whatever information is on file at the Social Security system, that's where their Medicare card is going to go. That's where any notices that you need to be aware of or that Social Security needs to send you are going to go. And if you miss that information or it's sent to the wrong address, that could be potentially concerning, because if your Medicare card is sent to the wrong address and somebody opens that mail and picks out your card, potentially they could use that card and access your benefits. So always make sure that your address is up to date at Social Security so that everything goes where it needs to go. Again, you can create a personalized account on the Social Security website, and they encourage you strongly to do that. Also be aware of anybody who contacts you about your new Medicare card. Social Security is not going to call you about a new Medicare card. Medicare is not going to call you about a Medicare card. This becomes your responsibility to make sure that you access or get your card, and they were not going to be proactive and do that for you. So anytime you may get a call that asks for that information, it is probably a scam. In the email I sent out earlier today, I included a couple of handouts from Social Security. One is the different kinds of things that you can do on the Social Security website to access information. And the other one was how to create a My Social Security account on that website as well. I also included in that email a handout on how to create a My Medicare account or a Medicare account on the Medicare.gov website. Again, accounts on these websites are strongly encouraged by both Medicare and Social Security, but they are not required. And there's no negative if you choose not to create accounts on these websites. However, there can be some positives, and they can be beneficial and helpful and useful if you do create those accounts. But again, they are not required. So I will take a quick pause there to see if there's any questions about any of this information so far. Again, if you have a question, you're welcome to type it into the chat box or simply unmute yourself and ask the question. I do have a question in the chat box that says, if I'm still working at age 65 and have full insurance coverage from the employer, what should I do? Do I need to notify Medicare, and how do I do that? That's a good question. So if you are still actively employed with employer group coverage and you are going to delay enrollment, meaning you are not going to enroll in Medicare because you have employer group coverage, you don't have to do anything, honestly. Social Security and Medicare, and if you go online and do a search, they're all going to encourage you to enroll in Part A, or make it sound like you have to enroll in Part A, but you don't. You can simply ignore anything having to do with Medicare until you stop working. Once you stop working, then you would contact Social Security to let them know that you now want to enroll in Medicare. They're going to ask you why you did not enroll sooner. You're going to tell them because you were actively employed with group coverage. They're going to ask you to fill out a form that proves or shows the dates you had employer coverage. You take that to your HR, they fill it out, they send it back to Social Security, and Social Security allows you to enroll during that 8-month special enrollment window. Now, if you know when you're going to stop working, having say a retirement date that you know of in advance, you can arrange for Medicare to go into effect like as soon as your other coverage ends, so that there's no gap in coverage. Or if you are losing employment at the last minute kind of thing, you can always ask Social Security to retroactivate Medicare for a month or two. So a lot of people will decide to enroll in Part A because Part A is at no cost for most of us. But keep in mind, any part of Medicare that you enroll in while you're actively working with employer coverage is usually going to be secondary to that employer coverage. So you can have both, but you may not need it, and you may pay for both and have double coverage that you may not need. So, and we'll talk a little bit more about that as about the process and throughout the 4 weeks. But if you're still working, you want to delay enrollment into Medicare so that you don't have premiums for 2 different insurances, you honestly do not have to do anything. Social Security does not expect you to call them and tell them you don't want Medicare. It's now become your responsibility to contact them, not their responsibility to contact you. Next question, is there a downside to enrolling while I'm still covered at work, and should I not do that? Again, if you do choose to enroll in Medicare while you're actively employed with group coverage, keep in mind that for most people that Medicare will become secondary to the group coverage. There may or may not be benefits to it, depending on how good or not good your employer group coverage is. And you may pay 2 monthly premiums for two insurances that may not be necessary. So you would certainly want to weigh the cost difference versus the benefit difference. For example, if you have a high deductible health plan through work that says, say, has a $10,000 deductible, it may be beneficial to enroll in Medicare so that any services that are applied to your high deductible plan can be billed to Medicare as a secondary benefit, and Medicare will pay their part because your high deductible plan paid nothing. That could be an advantage for people in that situation. If you have half decent health insurance through work, it may just not be cost effective to have both A and B of Medicare and employer coverage. The other option is if you choose to enroll in Medicare, you may also be able to drop employer coverage and use Medicare instead of employer coverage or employer coverage plus Medicare. Again, you'd want to weigh the costs and the differences to see which is more cost effective for you. For some people, employer coverage may be more cost effective because the employer pays a huge chunk of that, you pay very little. On the other hand, some employer plans you may pay $400, $500, $600 a month for. Medicare would be more cost effective and may be better coverage overall. So it's really going to boil down to understanding how much you pay for the coverage, how much you would pay for Medicare coverage, and which may be more cost effective for you or better coverage. So again, hopefully that answered any of the questions that were chatted. Here comes one more real quick. Part B. Okay, so Debbie, I will address your question further down the line, or I may address it at the end because that's a very specific question. Another quick question, if I enroll in Part A now, will it be difficult to enroll in Part B later? The answer is no. If you enroll in Medicare Part A when you first become eligible, even if you continue to work, that actually can make it easier to enroll in Part B when you stop working because you'll already be in the system. So it is usually, again, if you create an account, a My Social Security account on the website, you can enroll in Medicare A or B or both through that account. If you enroll in just Part A, but you continue to work with employer coverage, when you're ready to quit working and need to enroll in Part B, you go right back into that account and just enroll in Part B. And it becomes a pretty easy system, pretty easy process. Again, keep in mind that if you do delay enrollment into any part of Medicare in favor of employment, you are going to have to prove to Social Security that you were employed and had group coverage during that time. And again, that's simply a form that you fill out or take to the HR department for them to fill out, and then they send it to Social Security. And it's as easy as that. All right. So hopefully that answered most questions. Again, Debbie, please don't let me forget to readdress your question at the end. So now we're going to talk about the different parts of Medicare, starting with Part A for hospitalization. So again, I've just kind of covered whether or not you should enroll in Part A, depending on whether or not you're still employed or covered under employer coverage. The other thing you should know about enrollment into Medicare is whether you're still working or not. If you are currently collecting an income from Social Security for any reason, you started collecting early retirement and then found work after that, for whatever. If you are collecting a Social Security income of any kind when you become eligible for Medicare, that's the only time Social Security will automatically enroll you in Medicare. So if you're collecting an income from Social Security, you could receive a red, white, and blue Medicare card in the mail up to 3 months prior to the month of your 65th birthday. If you get that card in the mail and you're still working, you can sign the back of it and send it back and say, no, I don't want to take Medicare right now, I'm still working. Or if you want to go ahead and accept Medicare, you simply put it in your wallet. Keep in mind though that if you take that card and put it in your wallet and let it go into effect, you will be letting yourself be enrolled in Part A and Part B of Medicare, and they will automatically start deducting the premium for Part B of Medicare from your Social Security income the month Medicare goes into effect. And we'll talk about that a little bit more when we get to Part B. So, but if you're not collecting income from Social Security, again, Social Security doesn't care what you do until you're ready to enroll in Medicare. So whether you call them when you turn 65 or whether you call them when you stop working a year or 2 years later, they don't care because they're not already paying you. They're not automatically going to try and enroll you in Medicare. It becomes your responsibility to let them know when you want Medicare to go into effect. And if necessary, prove that you had employer coverage in the meantime. For most people, most of us will, by the time we become eligible for Medicare at age 65, most of us will have earned Medicare Part A at no cost. In order to earn Medicare Part A at no cost, it requires that you have 10 years or 40 quarters of work history or of paying into the Social Security tax and Medicare tax systems. So 40 quarters is the equivalent of 10 years of total work history. Now that 10 years of work history can be accumulated at any point of your lifetime prior to turning 65. So if you maybe had part-time job before or during high school, and then you were a stay-at-home parent, and then the kids left and you were able to go back to work, it doesn't matter when you accumulate that 10 years of work history and paying into the tax system, as long as you accumulate a total of 10 years before you turn 65. If for some reason you have not accumulated a total of 10 years of paying into that system before you turn 65, you can still get Part A, but you may have to pay a monthly premium for it. If you have less than 7 years of work history, your Part A premium could be pretty expensive, almost $500 for this year per month. It's a little bit less in monthly premium if you have to pay for it if you have, between 7 and 10 years worth of work history. If you're not sure, call Social Security or create a My Social Security account online, and it would be able to tell you whether or not you have enough work quarters or how many quarters you actually have. Now, if you're short 1 or 2 quarters, you can still go to work. Say you get a part-time job and work for the next year and pay into that system to earn that last quarter, you can certainly do that. And a lot of people do that. But again, it's Social Security that determines who has what and who's paid into what and who's earned what. And so they are the only ones that would be able to tell you whether or not you have earned those 40 quarters or not. But again, for most of us, it will be at no cost, which is why a lot of people enroll in Part A when they become eligible. And it's why Social Security and Medicare tend to encourage people to enroll in Part A, even if they are still working, because it has no monthly cost as far as a premium. So what does Part A pay for? So Medicare Part A is generally going to cover all inpatient services or inpatient benefits of Medicare. The primary benefit of Medicare Part A is going to be for inpatient hospitalization. So Medicare Part A will cover any and all costs for any reason that you are admitted as an inpatient to a medical hospital. And they will pay 100% for that stay after a Part A deductible. For 2022, the Part A deductible is $1,556. That deductible is applied per admission, not per year. So if you have multiple hospital admissions in a given year, you could potentially have that deductible applied multiple times. Once that deductible is met, Medicare pays 100% for any and all of the rest of your stay in that inpatient hospitalization. And that includes surgeries and all services and needs associated with surgeries or any other medical reason you're in that hospital. That also covers up to 60 consecutive days in the hospital for whatever reason you need to be there. If for some reason or some unfortunate reason you were in the hospital for more than 60 consecutive days, Medicare will continue to pay for that stay, but they will start applying what they call a coinsurance. And what that means is Medicare will continue to pay all costs for that continued stay, except for a daily coinsurance. And for 2022, that daily coinsurance amount is $389. So they'll pay everything after day 60, except for $389 a day. And that will cover you for another 30 consecutive days. And then if you're still in the hospital after 90 consecutive days, that coinsurance jumps up to $770 a day. Again, this would all have to happen consecutively, meaning all those days in a row. So it would have to be a pretty significant health issue for anybody to be in the hospital, honestly, more than 3 days these days. They try and get you in and out as quickly as they can. So that would be a worst case scenario. But for most of us, a couple of days in the hospital, Medicare pays everything except for that $1,556 deductible per admission. And again, that benefit period per admission, Medicare defines a benefit period per admission as a 90-day consecutive day stay. If you have a hospitalization, an inpatient hospitalization for any reason, and then you're discharged and you go back into the hospital for any reason within 60 days of your initial discharge, you will probably go back in on the same benefit period, meaning you'll start your benefit period count where you left off when you were discharged. If you have more than 60 days between your last discharge and your next admission, then you would start a new benefit period, and that's when a new deductible would be applied, and so on and so forth. There is no maximum amount of time that Medicare or a maximum amount of times that Medicare will cover inpatient hospitalization. There's no max out of pocket for medical hospitalization. However, for psychiatric inpatient hospitalization, Medicare does put a lifetime max of 190 days as long as you use a participating psychiatric hospital. But the same deductibles and coinsurances apply, even though they limit the number of days they'll cover. Again, all services and needs are covered while you're inpatient in the hospital, but there are some things that Medicare simply will not pay for. Personal convenience items such as your own telephone and TV, honestly, those are pretty standard for hospitalizations. Most hospital rooms, you get your own TV, you get your own telephone. So that's not really something you'd be charged extra for. Medicare will not pay for you to have a private room unless the doctor deems it's medically necessary, or even in a situation where there's no other space available and you're put in a private room. Medicare is not going to ding you for that. Medicare Part A does not pay for any need or the need of the first 3 pints of blood you might need. Honestly, no part of Medicare will cover the first 3 pints of blood someone might need in a situation. Medicare Part A does not cover private duty nurses or room sitters while you're in the hospital, nor does it cover what they consider self-administered drugs. When I say self-administered drugs, because typically any medications you're given while you're inpatient in the hospital are going to be covered under the Part A benefit. But if you are being discharged for the hospital, for example, so it's the day of discharge, but it's taking them forever to get you out of there. It's taking them forever to get the paperwork signed. And while you're waiting, it comes time for the staff to give you your maintenance medication. So they go ahead and they come in, they hand you a cup of pills, and they say, here's your maintenance medication. If you take that cup of pills and swallow them, you've just self-administered drugs, because on the day of discharge, you're no longer considered an inpatient and it's no longer covered under Part A. Potentially, they could bill you privately for those drugs. On the other hand, there are other ways that those could be covered under, say, your Medicare drug benefit, Part D. Part A of Medicare also covers skilled nursing facility care after a hospital discharge. So Medicare will cover the cost of you to go into a skilled nursing facility for rehab or recovery after you've had a hospitalization of at least 3 days or more. So in order for Medicare to cover any skilled care in a facility for rehab or recovery, they do require that you were in the hospital inpatient admission for at least 3 days or longer, and then are discharged to a skilled facility. Then Medicare will pay for the cost of that skilled facility care for rehab or recovery. If you meet that criteria, Medicare pays 100% for the first 20 consecutive days while you're in that facility. If you need to be there longer than 20 consecutive days, Medicare will continue to pay for that facility stay. But again, they will start applying what they call a coinsurance. That coinsurance, starting at day 21 of a consecutive day stay in a skilled facility for 2022, is $194.50 per day. So if you have a 3-day or longer hospital stay, you're discharged into a skilled facility for rehab or recovery, Medicare pays 100% for the first 20 days of that stay. Starting at day 21 up to the maximum day 100, Medicare continues to pay part of that stay, but they do start applying $194.50 per day coinsurance. So that's what they will not pay per day. Medicare pays all a part of up to 100 consecutive days in a skilled facility for rehab or recovery at a time. That's called the benefit period for that particular benefit. If for some reason you are still in that skilled facility on day 101, Medicare benefits cut off completely, and they no longer care why you're there, because at that point they stop paying. At that point, your options would be to either continue your stay there on a private pay basis, meaning out of your pocket. If you have invested in long-term care insurance, you may be able to access that benefit to help cover the cost of that continued stay. Or in some cases, you may qualify for the state Medicaid program to help cover the cost of that continued stay. Again, Medicare pays all or part of up to 100 days at a time. That's what they consider the benefit period. The reason they put a limit of 100 days to that particular service is because this particular benefit is designed to help people recover or become well enough to go home. And they have decided that if you have not gotten well enough to go home after 100 days in a rehab, then the likelihood of you ever becoming well enough to go home becomes pretty small. So they've made that 100-day limit. However, Medicare does not limit how often you can use this benefit. So you get an unlimited number of these 100-day benefit periods for the rest of your lifetime. But you do have to have 60 days from the time you're discharged from one rehab stay before you're readmitted to another rehab stay before you start a new benefit period. Less than 60 days, you go back in where you left off on the old benefit period. Hopefully that makes sense. The last benefits typically covered under Medicare Part A are going to be home health care and hospice. Home health care services and hospice services both require that a doctor certify your eligibility, meaning a doctor has to tell Medicare directly that you meet the eligibility criteria to get those benefits. If you receive those benefits, deductibles for Medicare do not apply, and most of those services are covered at 100% by Medicare Part A. An exception to that may be if you're getting home health care services and you are in need of a wheelchair. You can certainly get a wheelchair, but that's not going to be covered under your Part A benefit at 100%. That would be billed to the other part of Medicare, Medicare Part B, and Part B would only pay 80%. So there can be some limitations to these benefits, but as long as the doctor certifies your eligibility to Medicare and is willing to continue to certify your eligibility as long as you continue to be eligible, there is no limit to how long you can receive these benefits. Home health care benefits are designed to help keep you either maintain your current level of health or to help you improve or continue improving in your health. The hospice benefit, which is basically an end of life benefit, which is designed to help keep someone comfortable in an end of life situation. Again, there's no limit to how long you can use these benefits, but you do have to be eligible and the doctor has to continue to certify your eligibility to Medicare over the course of time. The one thing that the home health care benefit does not pay for through Medicare are going to be homemaker services. Medicare in and of itself only covers services that they consider medically necessary. So if you have any reason you have to have a medical procedure, service, or otherwise, as long as the doctor tells Medicare that that service was necessary, Medicare will pay for it. But under these benefits, things Medicare will not pay for that most people can associate with home health services, Medicare does not cover housekeeping or light housework. They do not cover personal care unless it's part of other eligibility. They will not help pay for someone to do the grocery shopping for you or to take you to the doctor's appointment. Medicare under home health care benefits will pay to have a nurse come in and continue your rehab that you were getting in the hospital or in the skilled facility. They will have a nurse come in and pay for them to check on a wound or a bandage or a cast or whatever you were in the hospital for or needed medical treatment for. But again, they will not pay for homemaker type services. So that is Part A in a nutshell. And I do apologize. It's been a few months since I've done one of these, so I'm a little rusty. But if there are any questions about Part A benefits before we move on, again, you can simply unmute and ask or type into the box. I do have a question. If someone is eligible for physical therapy through home health care and needs a wheelchair, is it better to get the wheelchair through the home health care agency or a durable medical supplier? That's a good question. So the home health care benefit, again, would fall under Medicare Part A. But if someone needs a wheelchair or a walker or something like that, that is a different benefit of Medicare. It falls under Part B. So it really doesn't matter how you get that equipment because it's going to be billed to a different part of Medicare. So whatever is going to be most convenient for that person, as long as they use a medical equipment provider that accepts Medicare or participates in the Medicare program. So hopefully that answered that question. Here's an interesting question. And this goes back to the previous section. If I decide to retire in another country and I pay for health insurance there, will I be penalized by Medicare? So keep in mind, Medicare is only good in the United States of America and or our territories. Once you cross the border, Medicare coverage stops. So it does not cover you in foreign countries. If you choose to stop paying for Medicare while you are in another country, because you're going to be paying for health insurance while you're in that country, through that country, and then you choose to come back to the United States and start paying for Medicare again, yes, there will be penalties. Leaving the country is not considered a reason not to penalize somebody for not being enrolled in that benefit. because it's not their fault that you didn't stay in the country, basically. So you can leave the country. If you continue to pay your Medicare premium while you're out of the country, you can come back at any time. Your benefits never went anywhere. You can just start using them as soon as you step back on US soil. But if you stop paying for Medicare because you're no longer in the United States or territories, and you come back later and re-enroll in Medicare, yes, you could potentially face penalties for not having other coverage in the meantime, or other coverage that the United States considers creditable coverage for that purpose. So yes, likely there would be penalties. Another question, if someone is on Social Security disability, is it possible to keep this benefit, or does one have to change to Social Security? I guess I'm not quite sure what you mean. If someone is on Social Security disability, again, you can become eligible for Medicare at any age if you've been determined to be disabled by Social Security. And usually that takes about 2 years. So once someone's determined by Social Security to be disabled, they start collecting disability income payments from Social Security. After 24 months of payments, you automatically become eligible for Medicare at any age. If you're on Social Security disability and you are turning 65, once you turn 65, Social Security no longer considers you disabled. Your status changes from disabled to retired automatically. Does that affect your income? No. Does that affect other health benefits? Possibly. Can you refuse to enroll in Medicare? Sure. But that may again have potential penalty or penalty potential in the future if you choose not to enroll in Medicare at 65 if you've been on disability. But if you've been on disability for more than 24 months, you're already on Medicare. And again, Medicare doesn't change when you turn 65. Your income doesn't change. So I guess I'm not quite sure what that question is asking. So maybe need just some clarification. Another question, what about needing medical attention while vacationing in another country? Okay, so if you are in another country and you have a medical emergency, some types of insurance that you can get to go with your original A and B of Medicare may include some coverage that would provide medical emergency coverage if you're in a foreign country. But that coverage is not going to provide you coverage at the time of the emergency. It will provide you reimbursement usually when you get back home after your trip. So most of the time, if you are in a foreign country, you have a medical emergency, you need to pay for that emergency while you're there. When you get back home, you can submit that bill or that expense to this other insurance and maybe get reimbursed. We will talk about this more next week when we go over Medicare Advantage plans and Medicare supplements. Medicare itself, no, there is no reimbursement. There is no benefit at all through Medicare once you cross the border of the United States of America and or our territories. My best suggestion to people who are planning to travel out of the country is to purchase travel insurance. And that's my best advice. But again, we'll talk about that in more detail next week when we talk about other insurance options for Medicare. All right. I am running behind here, so we're going to speed it up a little bit. So now we're going to talk about Medicare Part B. Medicare Part B is basically going to cover all other kinds of services. So Part A covers inpatient services. Part B is going to cover outpatient services. Again, things to take into consideration. If you're actively employed with employer group coverage, you don't necessarily need to enroll. If you are already collecting a Social Security income, Social Security will automatically try and enroll you in Medicare at 65 and automatically start deducting the cost of Medicare Part B from your check if you let that enrollment go into effect. For most of us, Part A has no monthly premium because we pay taxes. For everybody, Medicare Part B has a premium. So everybody, no matter how long you've worked or how many taxes you've paid, everybody has to pay a premium for Medicare Part B. There are some situations or insurance types that require that you have both A and B of Medicare. If you want to buy a Medicare supplement or Medigap, if you want to enroll in a Medicare Advantage plan, if you are eligible for TRICARE, meaning you're retired military, you have to have both A and B of Medicare. I get a lot of questions from veterans who are not retired military, but access the VA health system, whether or not they need to enroll in Medicare if they use the VA health system. And the answer is probably. Medicare and the VA health system do not work with each other, and the VA health system is not considered health insurance. It's a health system, but it's not considered health insurance. So it would not be considered a good reason not to enroll in Medicare as far as Social Security is concerned. So again, people can choose to enroll in Medicare, both A or B or both, for any reason. And Medicare will always give you that annual enrollment period, the general election period, if you choose to enroll in Medicare later. But whether or not you had coverage in the meantime is what's going to determine whether or not you end up ultimately having to pay a penalty to enroll in Medicare late. And using the VA system is not considered a good enough reason to not be penalized if you wait to enroll in Medicare beyond your first eligibility. But again, we've talked about if you're still actively employed and have employer group coverage, or you have employer group coverage through your spouse's employment, that is the only excuse Social Security will accept for not penalizing someone for enrolling in Medicare past age 65. You get that special enrollment period if you wait to enroll in Medicare because you were employed, or you can enroll during a general enrollment period, which will generally include penalties on your premium. Now, having said that, what's Medicare going to cost you? Well, in 2022, Medicare premiums took a pretty significant jump and went from $148.50 a month in 2021 to $170.10 a month in 2022. That is the base premium for most people. Again, if you're collecting a Social Security income when you are enrolled in Medicare, Social Security will automatically deduct that $170 a month directly out of your check before they deposit it in the bank. If you're not collecting Social Security because you're choosing to delay Social Security income until full retirement age of age 66 or more, then you would be billed every 3 months for that Part B premium, or you can arrange to have it come directly out of a bank account monthly as an electronic funds transfer. And then once you start collecting a Social Security income, they will automatically start deducting it from that income. You'll not have any choice about that. So either you have it directly deducted from Social Security because you're already collecting income, or you will pay it monthly, or they will bill you quarterly for that Part B premium. If somehow you have incurred a late enrollment penalty because you didn't take advantage of your initial enrollment period, you didn't qualify for a special enrollment period, so you enrolled during a general enrollment period, that's when penalties usually are applied. The penalty for late enrollment into Medicare Part B is 10% for every full 12-month period that you delayed enrollment into Medicare beyond your initial enrollment. What that means is, and that 10% is going to be based on whatever that monthly Part B premium is the year you enroll. And Part B premiums do increase every year, so keep that in mind. So for example, if you wait 3 years to enroll in Medicare and you're penalized because you did not fall under a special enrollment, you didn't enroll during initial enrollment, you're going to be penalized a total of 30%. Multiplied by whatever that year's Part B premium is. So say you were eligible 3 years ago, you're enrolling this year, 30% times $170.10, whatever that comes out to is going to be tacked on top of the $170.10 premium. That 30% penalty that you incurred never goes away. It will always be tacked on top of your Part B premium. So even as the premium increases each year, your 30% penalty will stay the same, but will always still be tacked on top of that monthly premium. And again, that lasts forever. So I always encourage people not to incur penalties because they don't usually add up to much if you miss a year or two, but over a lifetime, it can add up to quite a bit. Also keep in mind that Medicare Part B premiums are now means tested. What that means is that the more you make, the more you pay. So Medicare has come up with this new rule. It falls under the law of income-related monthly adjustment amount. And what that means is when you enroll in Medicare, Social Security is going to go back and look at your most recent complete IRS tax filing, which is basically going to be from 2 years ago. As far as complete tax filings, they're going to see how much you made in that year. And if you made over a certain amount of money, you are automatically going to be charged a higher Part B premium. The threshold for that higher Part B premium is actually pretty high. For a single person, that threshold this year would be $91,000 in that tax year. If it's a married couple, that threshold is $182,000 that tax year. Anything at or below those benchmarks, you're going to pay the $170. If you get above those benchmarks in those tax years, you may pay higher Part B premiums, and the higher premiums are shown here. Now, if you made a higher income during that tax year 2 years ago, but when you turn 65, you are no longer at that high of income as you were 2 years ago, and you get a notice from Social Security saying you're going to have to pay a higher Part B premium, you can appeal that and tell them you no longer have that high of income. So you don't have to pay that higher Part B premium based on your current income. So keep that in mind. And any notice you get from Social Security that suggests that you have to pay a higher premium based on old information that no longer applies also details or outlines the steps you must take to appeal that or to disagree with that so that they don't impose that higher premium on you. But again, most of us will pay the base premium of $170.10 this year. Once you're enrolled in Medicare Part B and you're paying that Part B premium, Medicare Part B services, again, Part A covers inpatient, Part B covers outpatient. Part B services does have an annual deductible, $223 per year this year. A minuscule drop in the bucket compared to most deductibles these days. Once you've met that $223 deductible for 2022, Medicare Part B pays for Part B services at typically an 80-20 split. So you have initial $223 deductible, and then Medicare pays 80-20 for all outpatient covered services. So what exactly does that cover? Again, outpatient is outpatient, whether it's an office visit from your primary doctor or a specialist. It covers your x-ray and lab work. It covers all medical, surgical, and anesthesia services. Medicare will also cover medical second opinions. Again, no part of Medicare pays for any of the first 3 pints of blood someone might need, but Medicare Part B will start paying for blood at pint number 4. Covers ambulance rides for medical emergencies, covers annual vaccines, flu shots, pneumonia shots, covers the actual administration of a shingle shot. COVID shots, of course, are covered. Covers all your physical therapy, occupational therapy, and speech therapy for outpatient. Covers all your durable medical equipment, walkers, hospital beds for home use, wheelchairs, oxygen, those kinds of things are covered. There is some limited coverage for other types of services, as long as there's medical necessity for those services, such as podiatry, chiropractic, and vision services. Medicare does not cover things that are considered routine, such as if you go to to get your eyes checked to see if your prescription glasses have changed or need to be changed. That's not going to be considered medically necessary. It's going to be considered routine, and Medicare would not cover you to see an eye doctor for that purpose. However, if you have developed glaucoma or cataracts or poke yourself in the eye with a pencil, those are all medically necessary reasons to see an eye doctor, and Medicare would pay for those. COVID testing, obviously Medicare does cover COVID testing, covers COVID, any COVID related hospitalizations or medical needs. Unfortunately, I didn't go through this presentation and update it well enough, so this is kind of old information. I did just read, however, today that Medicare has decided that they will pay for at-home COVID tests for anybody interested. So if you wanted to go to the store to buy one of those at-home COVID testing kits, Medicare will pay for up to 8 of those per month, starting in the end of March, I believe. Medicare also expanded telehealth services during the pandemic. And of course, they cover all your vaccines and booster shots, telehealth services, and Medicare will cover telehealth services for more than just COVID-related services. They will cover telehealth services for any of your medical needs. Some of these slides are going to talk about what providers can use telehealth and what those costs would be. I'm not going to go over these in great detail unless somebody has questions, but they are available. And I did email this presentation to you as well, so that you can go back and review. Again, under Part B, some things that are not going to be covered by Medicare Part B are going to be those routine kind of services that are not considered medically necessary. I use the example of the eye exam to see if your prescription glasses have changed. Dental care is another benefit that Medicare does not currently cover. I know many of you may have seen commercials on TV, you know, all these celebrities saying, oh, you get dental and vision and, you know, get money back for your Medicare Part B and all these wonderful things. Those are not advertisements that are advertising Medicare coverage. They're advertising Medicare Advantage plans that are able to include benefits in addition to what Medicare typically covers. And again, we will talk about those in more depth and detail next week. Medicare does cover preventive services though. And when preventive services became a huge, big thing about 5 years ago, Medicare jumped on the bandwagon with both feet and now cover all benefits that they consider preventive at 100%. The list of services that Medicare will pay for as a preventive benefit are about 10 pages long. So I'm not going to go into detail about it. If you're interested in what Medicare covers under preventive wellness benefit, I would encourage you to get the Medicare and You Handbook, which you can get either by calling 1-800-Medicare and requesting a Medicare and You Handbook for Colorado, or you can go to the Medicare.gov website and look at it as a PDF. In that Medicare and You Handbook, there is about a 30-page section that goes into significant detail about all benefits that they will pay for at 100% that they consider preventive. And all of those are going to be identified by having a little blue apple next to them in that Medicare and You Handbook. So I would encourage you to look at that specifically if you want more information about preventive services. But again, covered at 100%, anything listed in that handbook. Medicare also covers what they call a Medicare preventive or Welcome to Medicare preventive visit. I know a lot of people have been used to getting annual physicals over their lifetime. Unfortunately, Medicare does not cover annual physicals. That is considered a routine benefit. What Medicare does cover instead is called a Welcome to Medicare preventive visit. It is not a physical. What it is an in-depth conversation with your provider to establish a baseline for Medicare and to perhaps suggest future preventive services that you might want to take advantage of. But it is not going to be a physical. The Welcome to Medicare preventive visit can be a use it or lose it benefit. You have 12 months to take advantage of it. And you need to be sure to identify with your doctor's office when you schedule that appointment that it is your Welcome to Medicare preventive visit. Whether you take advantage of that visit or not, you are still entitled to an annual wellness visit or wellness review. Again, this is not going to be a physical. It's going to be an in-depth conversation with your doctor to review your health history, your social history, your mental history, and potentially suggest future preventive services that you might want to take advantage of. Again, those services are detailed in the Medicare New Handbook. So that is Part B in a nutshell. I do see I have some questions in the chat box. So let me take a quick look at those. Let's see. What is the cutoff to require the $170 premium? We just had it added to the Social Security after never having paid before. So I guess I'm kind of not sure what that question is asking. I know if you are collecting Social Security, you got a huge cost of living increase for 2022. It's the biggest increase I've ever seen anybody get to Social Security in the 22 years I've been doing this job. 5.9% was a huge increase for a lot of people. But again, the Part B premium also had a huge increase of almost $30, over $20. So I guess I'm not quite sure. If you could clarify that question, I'd be happy to try and answer it again. Another question, screening colonoscopy or non-screening? Known polyps or not? And then insulin pump supplies. So if you are going to a doctor's visit for a follow-up, meaning you have a history of, say, colon polyps that have been treated in the past, and it's time for your annual visit to make sure those polyps have not redeveloped. That is not a preventive visit. That is a medically necessary visit that Medicare will pay 80% for. If you have never had a screening for any sort of colon cancer or colon issues, and it's time for you to finally get the very first one you've ever had, you don't have any history of, you don't have any necessarily any suggestion or symptoms of, and the doctor says, oh, you might as well go get your colonoscopy just to make sure that there's nothing that we're missing, that would be considered a preventive service covered at 100%. But if you're doing a follow-up or if you have history of, that's not considered preventive. And insulin pump supplies usually fall under Part B as medical equipment, and obviously would not be considered, I guess, preventive if that's what you're asking. So I'm not quite sure about the medical supply, insulin supply pump issues. If you want to clarify that, I'll try and answer it again. Next question is, under what part of Medicare are blood tests covered? And how do you figure out what blood tests Medicare will pay for? Okay, so blood tests or lab work of any kind is covered under Part B of Medicare. The bottom line regarding Medicare coverage, the bottom line is the doctor is responsible, the ordering doctor is responsible for telling Medicare that whatever they're suggesting you need to have done is medically necessary. And they can do that a variety of ways. They can either make notations in your medical chart that indicate that you have a qualifying diagnosis or suggestion of a medical need. They can put a diagnosis code on a script that they hand you that you take to the lab. Excuse me, or what have you. But it's the doctor's responsibility to make sure there's enough medical necessity in that record, in that order, so that when the lab bills that to Medicare, Medicare will pay for it. If you've come across a situation where the doctor wrote up an order for you to take a bunch of lab tests, you went over there, you took those tests, and then you got a bill later because some of those tests weren't covered. Unfortunately, what that means is the doctor probably did not put enough information on that script to justify the necessity for all of those tests. I always encourage people to ask their doctors if there's ever any question, or even if there's not any question, just so you know for sure. Don't hesitate to ask your doctor, will Medicare pay for that? It's their responsibility to make sure Medicare knows that it's a medically necessary need or service. If for some reason the doctor says, Medicare may not cover that, your first response would be, then why do you want me to have it done? It's bottom line, because it is their job to make sure that there's enough information to prove necessity. Unfortunately, I get that lab question issue a lot, and I've worked with many clients in the past who've been in that situation. It's not an easy situation to fix, and that's why it's all the more important that I encourage people to ask their doctors for any medical need, for any medical service that a doctor may be suggesting or encouraging them to get, whether or not Medicare will pay for that. It's their job to know, and it's your job to ask. Next question is, if insulin pump supplies are covered under Part B, then the assumption is they are covered at 80%. I guess I'll find out next week if GAP or Advantage plans pay the other 20%. Yep, that's when we'll talk about that. What other insurance is available to pay what Medicare left over? Would the colonoscopy that isn't routine be paid for at 80%? Yes, as long as the doctor says it was necessary for you to be there because it was a follow-up to previous issues, then Medicare will cover it. But again, it comes down to the doctor providing the documentation or the information that says this was medically necessary. And when that's billed to Medicare, Medicare will pay for it. Anytime you're not sure, anytime there's any question, hesitation, inkling of doubt, ask the doctor, will Medicare pay for that? They should be able to tell you. If they can't tell you, I'd be a little worried about your doctor, unfortunately. But it is their job to know, it's their job to provide that information to Medicare, so Medicare does pay for it. All right. So I will move on. I am not ignoring your question, Marianne, but you have some very specific questions that I don't necessarily want to get into in this open forum that we may need to get together one-on-one about. So let's talk about that again at the end. We're almost done. Okay, if there's no other questions about Part B, just to let you know, there are programs available that can provide some financial assistance on the costs for Medicare. The program we're going to talk about tonight is Medicare Savings Program. This is a program that is designed to help cover the cost of the Medicare Part B premium. Medicare Savings Program will for people who are eligible and qualify, may cover the monthly Part B premium so that it is not deducted out of your Social Security income, but is paid by the state. It may, depending on income and resources, you may also qualify not only for the state to pay the Part B premium, but you may also qualify for the state to pay your Medicare deductibles and co-insurances. If you qualify for this assistance program, you would automatically also qualify for assistance on drug coverage through Medicare, the Medicare Part D. If someone is interested in seeing if they are eligible for this program or want to apply for this program, we do help with these applications at our office. We can absolutely talk to people about their eligibility and help them submit an application. These programs are determined, eligibility is primarily determined by income and asset limits. Income and asset limits are still at the 2021 levels because the new limits for 2022 will not come out until the feds come out with the federal poverty level numbers, which may not happen for another month or two. So these are the current limits, even if you're applying in 2022. For a single person, if your income is $1,496 gross pre-deduction income or less, you may qualify for some of this assistance. You would also have to have assets, meaning liquidatable assets, checking, savings, property you don't live on, stocks, bonds, that kind of stuff, of $9,470 or less to qualify. At the high end, for a married couple, that would be $14,960 in assets. They do not count your home that you live in. They do not count your primary vehicles. They do not count your personal possessions, but they will look at all other resources. Again, if anybody wants any more information about these programs, we help with these programs and this application process. You're welcome to give us a call or shoot us an email, and we're happy to give you more information or assist you with applying. And I know we ran over time by about 15 or 20 minutes, but we are done with Part A and Part B. If you have other questions or you want to talk one-on-one about your specific information or situation, we are there to help. Again, the SHIP program, which stands for State Health Insurance Assistance Program, is a federally funded program. Every person in every county of every state should have access to a SHIP counselor, if nothing else, through a toll-free number. This slide shows you the statewide toll-free number for Colorado. No matter where you're calling in Colorado, if you call that number, it will route you to the SHIP office closest to you. If you want more information about the SHIP program in general, or you have interest in volunteering for this program, we would encourage you to look at information on the website, shiptacenter.org, for more information about that. During this 4-week course, I will be asking you to participate in a nationwide survey that is being done by the government that will basically give you an opportunity to provide feedback about the SHIP program and our activities and these presentations. This survey will probably be sent to you after the 3rd or 4th week presentation. I just wanted to give you guys a heads up. Again, this is done by the government that gives us our money. And so it's basically asking us to prove that we are doing what we say we're doing. So I would strongly encourage you and honestly really appreciate anyone who is willing to take that survey when it comes out. You will be getting a survey after this presentation, but it will be an internal survey. We send out surveys after every presentation just to get your feedback. But again, this will come at the 3rd or 4th week instead. Our office is also responsible for what's called the SMP program, or Senior Medicare Patrol. This is the fraud prevention and education part of the SHIP program. And this is the part of the program where we help educate people about fraud and scams. We can help people who have issues with billing, or if they think their Medicare number has been stolen, or their doctor's billing them for services they haven't received, that kind of stuff. This program is also volunteer controlled. And so we're always looking for volunteers. This is probably the funner part of the SHIP program to volunteer for. And it requires a lot less training. Anybody, again, interested in any volunteer opportunities, either with the SHIP program, the SMP program, or even the Area Agency on Aging, we are always happy to talk to you, and we are always interested in volunteers. And I've provided the website and some contact information for that. Again, always looking for volunteers, whether it's the SHIP program, the SMP, or the Area Agency on Aging. Volunteering for any of these programs can be very rewarding. It's very rewarding to help people. And that is all I have for you tonight. Again, thank you so much for your patience. I apologize that we ran over. Again, this is the first one I've done in like 4 months, so I'm a little rusty. It'll be better next week, I promise. I'll take a quick look to see if there are any other last minute questions that I can address. And it looks like I appreciate your thanks. I'm glad you found this useful. Anybody who has any additional questions or wants to talk about their specific situation, again, you're more than welcome to give us a call. You can call our local number at the 635-4891. You can call the toll-free statewide number. It will route you to our office here in Colorado Springs. You can send me an email. This email address goes directly to me, and I'm happy to take any emails and answer any questions I can through the email. Or you're welcome to give us a call. We currently have 5 counselors on staff that are all fully trained and would be able to help you. So there should be someone able and willing to talk to you if you call our office as well. Right now, we are primarily working remotely still. We're only going into the office 1 or 2 days a week as needed. Hopefully that will change sometime in our lifetime. We will be done with all of these restrictions and can go back to the office and see people in person. But as of right now, we're still only rarely in the office, but happy to help you over the phone or through email. Please don't hesitate to contact us. I do appreciate all the things. I hope everybody found this helpful and informative. And hopefully I will see you all next week for our part 2 session. And unless I see any other questions or hear any other questions, I will let you guys go for the evening. Thank you all and have a good night. And I hope to see you next week. Call us if you need us.